When we talk about melanoma risk, the first thing I want you to know is this. Not everyone starts from the same baseline. Some people are just born with more risk in their skin or on their genes. Others have built up risk over years of sun exposure or medical treatment. Let me walk you through the main high risk groups so you can understand where you stand on the map. The strongest risk factor of all is your own past history. If you've had a melanoma before, you are automatically in a higher risk category. Why? Your skin has already demonstrated that it can produce melanoma once, and that means we follow you more closely for the rest of your life. Regular checks are protective for this group. The second big group is family and genes. If you have a strong family history of melanoma, especially close relatives with melanoma, and especially more than one, your risk rises even if you have been careful in the sun. A small number of families carry a specific melanoma associated genes, such as CDKN2A. But even without the named gene, a cluster of melanoma in the family is a red flag. These people may develop melanoma without being callous in the sun. Next is your skin type and your type of moles. Very fair or freckled skin that burns easily, blue or green eyes, red or blonde hair, and lots of moles all push your risk up. That risk climbs further if you have many large and irregular looking moles, or what we call dysplastic nevi. Think of it this way. If each mole carries a small chance of change, then having many moles means many small chances. Then there is the kind of moles these are. Are they standard regular ones? Or are they irregular looking ones? I often tell patients quite deliberately that boring skin is good. When I say your moles are boring, not exciting, not interesting, I mean they are regular, predictable, and stable. And that is reassuring. The more visually busy or interesting your skin is, the more closely we want to watch it. A very common question I hear: Doctor, I hardly ever in the sun. How do I have so many moles? Or, these moles are on my abdomen, on my buttock. They never see the sun. Why are they there? And the answer is important. Not all moles are sun driven, many are genetic. Your skin has the machinery to make moles, whether or not the sun is involved. This is why parents are often puzzled when children develop moles despite careful sun protection. Sun matters, but it is not the whole story. Then we come to the lifetime of sun and UV radiation exposure. I emphasize lifetime because melanoma is rarely about a single bad holiday. Childhood and teenage sunburns, especially blistering ones, matter greatly. Years of outdoor work, repeated intense exposure, tanning beds, or solariums, which are now banned, of course, and living in high UV environments like Australia, they all add up. People often tell me they've avoided the sun for 10 years and wonder why skin cancers still appear. The answer is that melanoma risk reflects cumulative damage over decades, not just recent behavior. Another important high risk group includes people whose immune systems are suppressed. If you have an organ transplant or you take long term immune suppressing medications for conditions such as rheumatoid arthritis, inflammatory bowel disease, or certain blood disorders, your risk of skin cancers, including melanoma, is higher. Your immune system normally helps search out abnormal cells in the body. If this is weakened, they go unchecked. Finally, people with multiple previous skin cancers of any type, BCCs, SCCs, they deserve special attention. A long history of any skin cancers tell me that your skin environment is high risk. Sometimes patients tell me that they have many BCCs burnt off or frozen off. But when I ask whether these were biopsied, the answer is no. This matters. The term BCC is often used loosely to reassure patients, but the true basal cell carcinomas, BCCs, has a real biology and should be diagnosed properly. Accurate language protects patients. So when you step back, the major melanoma risks are quite clear. A previous melanoma, a strong family history or genetic background, your skin type, your moles, highest lifetime sun and UV exposure, a suppressed immune system, and a history of multiple skin cancers. The aim is not fear, the aim is early detection when melanoma is most treatable. And if you recognize yourself in any of these groups, it does not mean you should panic. It means you're exactly the sort of person who benefits from regular professional skin checks and from learning on your own skin well. The aim is not to scare you, it is to catch trouble early when melanoma is most curable, replacing worry with a clear plan.